We'll just wait for a few more people to come in and find their seats. Maryam, can you hear us?
Yes, I can, and I hope you can hear me too.
Yes, perfect. Thank you very much. Okay, let's begin. Guten Tag, good afternoon, everyone. My name is Kholood, Khair, and I'm the director of Confluence Advisory, which is a think and do tank formerly based in Khartoum, Sudan. And it's my pleasure to moderate the session entitled, Where is Everyone Understanding the Gaps in Sudan's Emergency Response? This panel aims to delve into the lack of humanitarian response in Sudan, which mirrors that seen in other crises worldwide. There is a notable absence or insufficient presence of humanitarian access despite the urgent needs. In one of the world's worst crises for decades, Sudan is facing a colossal, man-made catastrophe almost 1 year and a half to the day, today's the 16th, after the war started in Sudan between the Sudanese armed forces and the rapid support forces. By scale, and sometimes by intensity, Sudan's conflict has resulted in the world's largest humanitarian, hunger, displacement, and protection crises. Beyond the numbers, urgently enabling safe humanitarian access is quite literally a matter of life and death for millions of Sudanese. While the humanitarian system has grown massively in recent years, this has not led to a proportionate improvement in performance during emergencies. We also see an increase in attacks and blockages of humanitarian aid, using aid as a political or war strategy by conflict parties. The panel will discuss why there is such a lack of response, even in more accessible areas, why some actors continue to persist in self-imposed restrictions on accessing these regions, and how the humanitarian sector can find solutions to these problems and scale up activities across the country. Allow me to introduce our esteemed speakers for today. We have joining us virtually is Maryam Elfaki, who's a Sudanese democracy, social justice, and peace activist. We have Ozan Agbas, who's the emergency manager for Médecins Sans Frontières. We have Betty Carr, to my immediate left, who's the director, Supply Chains Operations Division for World Food Programme. And we have Christina Förster, the deputy head of department from the German Humanitarian Assistance in Countries and Regions from the German Federal Foreign Office. So let's begin straight away. First question goes to you, Agbas, Ozan, because you've just returned from Nyala, South Darfur, where MSF is active. And we're hearing of a multitude of needs that are rapidly increasing. Could you briefly describe what the situation is like in Sudan, and also the primary challenges your organization is facing, and what the main needs of the population are?
Sure thing. Thank you, Kholood. That's a great opportunity, and thanks everyone for joining today. I will start with maybe a little nuancing on the title. Where is everyone should be probably replaced with where is international community, because everyone is actually there. And that was one of my first observations in Nyala. When I was there for a few weeks, just recently returned, I could see, first of all, the patients, people affected from the conflict, the local communities, and also the local responders, the volunteers, the initiatives, local NGOs. They are there. People are in those places, in those pockets. They are exposed to different types of violence, discrimination, lack of humanitarian aid and support every day in their lives. Who is missing in this picture is the international community and international actors, humanitarian agencies, United Nations agencies, and many other international non-governmental organizations. It's not only in Darfur, as you mentioned rightfully, it's also in the rest of Sudan, where we consider more accessible, such as Kassala, Gedaref, Omdurman in the east of the country under the government control. We are also seeing actors either missing or with a very little presence. Very little activity, very little presence, and there are good reasons for that, but maybe it's good to today break it down and understand how we can overcome some of those challenges. Before going into that, I will share a little bit of a snapshot of what is happening in Sudan right now. As you rightfully mentioned, it is the largest humanitarian crisis right now in a single country from many angles. More than 25 million people right now in Sudan are in need of urgent humanitarian assistance. And more than 18 million people are actually in a situation where they are suffering from food insecurity, and many of them, especially the children, pregnant women, are suffering from malnutrition. We have so far recorded, or at least there is some, the estimates suggest that there are more than 10 million displaced people in the Sudan, in different corners of the country. And important to mention here, this is the number of people displaced, but the number of displacement, if you look at how many times these people have been displaced from a place to another, is countless. We don't even know. Everybody I spoke in Niyala or in Gedaref told me the story of how many thousands of kilometers they took march to flee their homes, and they had to go to nearest location that they considered safe, and then it was attacked, or there was no aid, so they had to move again. And in the end, we're looking at 3, 4, 5 times displacement all over the country, going through very difficult journeys. Most of those displaced people that I had the opportunity to talk to shared their stories that are similar. They were exposed to violence during this journey. They lost family members, friends. There was robbery. There was blockade. They couldn't cross from one place to another. Or there was insecurity, just violence due to the conflict itself. Shellings, shootings, and all type of other violence, conflict-related violence. Also, a little bit zooming in into some specific needs. If you look at the nutrition right now, I'm sure many of you heard about it already. The IPC committee declared famine in parts of North Darfur, in particularly Zamzam camp, but also in the rest of the Sudan when it comes to nutrition and food insecurity. The situation is very, very concerning. 1 out of 3 children that were screened in our clinics in Zamzam camp, but also in the pockets of Niyala, are acutely malnourished. They are suffering with malnutrition. They're suffering with food insecurity. And important to remind is 1 child in a family suffering from malnutrition means that family is going through food insecurity. So we are actually talking about thousands, hundreds of thousands, millions of people struggling with the food situation in most of the part of Sudan. I gave the examples from Darfur, but this should not mislead us. The situation in government-controlled areas, for example, in Omdurman, isn't too different. In Omdurman, there are 2 hospitals providing inpatient feeding service for the children under 5, and both of them are overwhelmed, turning patients down, and one of them had an increase of 300% in their admissions for the severely acute malnourished kids in their services in August. And this situation is ongoing right now. A lot of children are turned away. They cannot access to these services, and as well as the pregnant women, lactating women who are suffering with the similar problems. The conflict is ongoing. We are not talking about something that happened in the past, an event that is over. We are talking about an event that is ongoing every day, still affecting people's lives. In again, Omdurman, where we are supporting a hospital, is called Al-Na Hospital. They treated, and it's run by Ministry of Health, in very difficult conditions, circumstances, lacking supplies, medical professionals who fled because of the war. But despite that, they have treated more than 10,000 people with war wounds, war injuries, since the beginning of the conflict. By the way, just to note, today is actually the 18th month into the conflict. It's the 18th month anniversary. It started on the 15th of April 2023. So we're talking about more than 10,000 patients coming with injuries directly related to conflict because of airstrike, shrapnel, shooting, coming to the emergency room services in Al-Na Hospital. In Al-Bashir Hospital, just across the front line, under the RSF-controlled areas in Khartoum, it's not too different. Since the beginning of this year, more than 3,200 patients with similar injuries were treated. So we are looking at a very similar impact over the civilians on both sides of the front lines and in the hospitals located in those areas. Sexual and gender-based violence is prevalent. Unfortunately, what we know is not even the tip of the iceberg, to be very honest with you. The services are limited. The health care for the survivors of sexual violence is mostly non-existent, or if they are available, access is limited because of many reasons, concerns around security, concerns around stigmatization, and so on. And Sudan is not lacking any outbreaks. Unfortunately, it's not in shortage of any of them. We are facing right now a massive cholera outbreak in many corners of the country. Right now, MSF teams are responding to cholera in more than 5-6 locations, both under RSF and government-controlled areas. There is measles, particularly concerning because of the lack of immunization. We should remind ourselves that there was a years of political crisis and challenges in healthcare already in Sudan, and immunization services, public health services were already struggling before the conflict. And since conflict started, with the blockades or obstructions or insecurity, it even became harder for the Ministry of Health or the health providers to actually provide basic services such as vaccination. And when we don't have vaccination, it's just consequential. We start seeing outbreaks threatening the well-being of the community. The maternal deaths is notable as well. I think it's something that we have, as Doctors Without Borders, we have started seeing a little later. When we look at our data recently, we found out that it's actually quite concerning how many women died before, during, or after birth, after delivery, because of the complications related to pregnancy in the hospitals, in the health facilities, or in the community. The numbers are unknown when it comes to the community. How many women actually couldn't access to healthcare and therefore lost their lives or babies died. We don't even know that. But what we know is in 2 facilities that MSF supports in Nyala, in South Darfur, in 6 months' time from the beginning of this year until June, more women died because of those complications than the entire Germany in 2020 or many other countries. So the numbers are extremely concerning, and the reason for death is actually easily preventable. But with the lack of services and lack of access, unfortunately, those deaths are continuing in many parts of the country. So, in summary, when we look at all these needs and when we look at the existing health services, we can, I think, confidently say that the health system actually collapsed in majority of the country. In some parts, the Ministry of Health are able to support the facilities, but the existing health facilities that are able to provide services is 20 to 30% of the total number of the health facilities in Sudan. Most of them have become non-operational or let's say, lost their ability to function because of insecurity, shellings, bombardments, or lack of supplies, lack of salaries, lack of medical professionals. There are many reasons, but to give you an example, for example, when I was in Nyala just a few weeks ago, I was able to visit the Nyala Teaching Hospital. Nyala Teaching Hospital is one of the largest tertiary facilities in the whole region. It used to receive patients, referrals from the neighboring countries because of the level of service available in the past. The hospital right now is, let's say, hardly able to provide any services. The only existing services are maternity, pediatrics, and ER that are supported by MSF at the moment. The rest of the hospital is still, let's say, the rest of the hospital still is not a hospital. The walls are sprayed by bullets, and the roofs have collapsed. Most of the buildings don't have roofs or have big holes, no windows, no water, no electricity. So it is almost impossible to provide actually any health care in those facilities in a safe and healthy manner. And it's just one example of many others. The hospitals in Omdurman, south of Omdurman, are not any different. Another example, the maternity hospital of Omdurman, it was, again, one of the largest hospitals in the past, had to move into the compound of Al-Now Hospital to be able to continue providing the emergency maternity services during the early periods of the battle in Omdurman. So this is more than a year now. And 2 months ago, when they actually wanted to move back to their original compound after some renovation and cleanup, on the first day of their services became available, the hospital received a shelling, and they could not continue working there. They had to go back to Al-Na Hospital compound. So this is all examples. These are all examples of the challenges that the health system is particularly facing. But of course, it has the impact on the whole community. Overall, what we see is the humanitarian needs right now in Sudan is disproportionately higher than the response and the attention given. The media representation of Sudan, or the Sudan crisis, the humanitarian needs, is, well, is there any really media representation of those needs? Maybe apart from the last few months, as we start seeing some of the needs, but it doesn't exist. It is incredibly low. It's incredibly insufficient. It's not just the media representation. This is one, of course, consequence of the potential attention given to Sudan conflict and the humanitarian crisis, but also the funding, humanitarian funding, the presence of actors, the humanitarian organizations is incredibly insufficient. 18 months into the war, what we see is an inability to establish large-scale humanitarian operations throughout the country by the major humanitarian agencies, primarily by the United Nations agencies, but also by the international organizations. We need scale-up now, even yesterday, of scale-up response, of response, which we're not seeing on the ground. Of course, there are good reasons, as I mentioned earlier, and I would like to maybe go through some of them now. But again, to mention...
Ozan, can I ask you to be very brief so we can move
Sure.
on to Maryam? Thank you.
All right. Well, then, very briefly, one of the good reasons is, of course, Sudan is a very challenging place to operate in terms of bureaucratic, administrative impediments and obstructions. We are facing, by both warring parties in this war, different types of challenges and obstacles and obstructions and blockades. Khartoum city was blocked against delivering humanitarian medical assistance for a very long time. And similarly, now we see Zamzam becoming the new difficult place to access. So we see both warring parties using similar methods to use the aid tactically, and sometimes particularly crossing front lines or crossing borders into areas where the warring parties do not want us to reach, becomes an incredibly challenging task. We have to get travel permits. There are there are movement restrictions within the country. It makes it very difficult for the humanitarian staff and goods to travel into the areas where they are most needed. We also see bureaucratization of the procedures that makes it very long or sometimes impossible to overcome, and therefore a lot of warehouses are full with items and supplies stuck in main urban centers, unable to be delivered to the areas with the most needs.
Actually, let me come back to you on this one, because I want you to take more time on this particular issue, because I think it's a big obstacle that we're seeing in terms of delivery of humanitarian aid, and I don't want to rush you. I also want to turn to Maryam. Thank you so much for joining us, Maryam, even if it is virtually. Just moving on from what Ozan is describing, which is basically a system of collapse, not just in terms of the domestic picture, but also the international picture. Clearly, we're not seeing the requisite response. But as you said, Ozan, there are people who are working. A notable example is local structures and mutual aid groups, whose unique structure proved particularly effective in this conflict. Maryam, I'd like for you to share with us, please, how these structures are continuing to play a role in alleviating the suffering amidst the crisis, excuse me, especially given the collapse of health systems, food supply chains, and other services. And if you let us know just what is working locally and what particularly should be supported.
Greetings, everyone. I hope you can hear me loud and clear.
We can, thank you.
Thank you. So first of all, I'm very honored to be part of this important panel today that is focusing on the humanitarian crisis in Sudan. The situation there, as you spoke, Ozan, remains dire as millions of lives have been uprooted by the ongoing conflict. despite the growing needs, the humanitarian response has been lacking, particularly in hard-to-reach areas and even in safe areas as well. I also would like to second what my colleague here mentioned, that the question should be, is because everybody is there except for the international actors and humanitarian aid actors. So thank you for that again, and I will, to answer your question, Kholood. So just to come back to the nature of the formation of these mutual aid groups, these groups have played a critical role in the context of the war, and they were formed they actually emerged as a response to the state's inability to provide essential services and support its citizens as a result of the sudden war that broke out last year. The efforts of these groups cannot be limited to one or two things. I can say they are basically addressing the humanitarian needs in crisis. So this means, or this includes providing the basic necessities from health services to the states, from health services to building social cohesion, to supporting people who are displaced, or let's say the displaced population, helping in evacuating also the people who are trapped in the risky or hot areas, if we can call them that, empowering as well local communities, running soup kitchens. So it's these local communities, or let's say these mutual aid groups, are basically replacing or doing what is the state was supposed to be doing in the normal context. So, for example, you will have the brave volunteers who are running hospitals or supporting in the running of hospitals, supporting in the delivery of medical supplies. They are also supporting in the health, providing the health services, the basic health services to the citizens in Sudan. Of course, I'm sure everybody knows about the famous initiative for the soup kitchens that provide food services or daily meals for the population, as well as it supports building the social cohesion and solidarity, as their soup kitchens are run by the people or by the community, and it brings us a sense of mutuality and solidarity. It's also the support of the displaced people, or displaced population. You'll find volunteers from the local communities, or let's say the mutual aid. They're running the shelters, organizing shelters, or actually organizing first evacuations and then organizing shelters with even the limited resources and the security risks that they have to go through. There's also very important part that is supporting the vulnerable part of the community, that is women and children. You will have initiatives for education, you will have initiatives to alleviate the suffering of the children and the trauma, to reduce the trauma of the war on the women and children as well. So all in all, I would say that these mutual aid groups, these grassroots mutual aid groups, are basically running the humanitarian situation, or managing the humanitarian situation in Sudan currently. Thank you.
Thank you, Maryam. And I don't think that's an overstatement in any way. I think what we are seeing is that these mutual aid groups are effectively plugging the gaps for not just the state, but also the humanitarian sector. And they're doing so under very, very difficult circumstances. So Betty, if we can turn to you, we just heard about the massive needs, and we've also heard, of the sort of multitude of different crises that are interplaying here in Sudan. Could you let us know what WFP is doing to respond to these needs, and what challenges that you are facing in terms of the scale up to the response? What is proving difficult when it comes to new ways of working and new partnerships?
Thank you very much. Thank you very much, Kholood. Thank you for the invitation, Ozan. Really happy to be here, especially when the question is, where is everyone? I think the answer is, we are here. We are here. Here, the international community is there, but is not able to work to the level that is required. If we look at the sheer number, and Ozan was talking about 25 million people are now impacted by the crisis and are suffering in any shape or form, any type of hunger and hunger-related crisis. That's the population of Australia. That's the entire population of a country. So if we go back 20 years and we look at the Darfur crisis, and everyone was aware of the Darfur crisis and the magnitude of the Darfur crisis, take that and multiply it by 10 and spread it across the entire country. That's what we are facing today. We're talking about lack of media attention. And we are not competing with other crises, but Gaza, that is getting all the media attention, is 2 million people. Before I was deployed to work on Sudan, I was working on Gaza. The suffering is not the same, and again, I'm not comparing, but Gaza is 2 million people, Sudan is 25 million people that we're talking about. So for a response to be coherent, it has to be all hands on deck. So I agree that there should be, one, much more media attention, much more political engagement to put pressure on the parties to either cease fire or grant unfettered access and safe passage to humanitarian actors. I was deployed 4 months ago to support the Sudan crisis, putting Sudan at the center of the response, and also supporting the neighboring countries that are now impacted by the crisis. And the sheer number of people that are displaced inside the country, not to mention how many times they've been displaced, but also the people that are moving abroad, which we also have to support. So when we try to do cross-border operation from Chad to enter Sudan, we also have to support the Sudanese that are now in Chad. And numbers indicate that there will be anything between 2 and 2.5 million people that will be moving out of Sudan and displaced in Chad, which gives the crisis a regional magnitude. So how are we going to respond? We are responding twofold. With food, which is our primary mandate, so food in kind. We're bringing food from outside, distributing it to the populations that are impacted. And we are buying food inside Sudan in areas that are not fully impacted by the crisis, but to make sure that the economy is still continues to function. So some of these farmers continue to plant and continue to produce. They need the possibility to sell the proceeds so that the crisis does not also impact them. So with food and with what we call cash-based transfers. So we are using what the diaspora is using. We are using mobile money providers in some areas that are very hard to reach. So, and where there is internet, which is not a given. So we are using mobile money, we are using food stamp, so the vouchers solution. And because Zamzam was impossible for us to get into, we had to revert to food stamp solution, trying to use the trade route and the traders for them to keep the food and distribute to the population who will be redeeming those food stamps. So we have to be very creative because the needs are vast, the country is big, it's very difficult to operate cross-line. So we have relocated our offices, all of us, most of the humanitarian actors, from Khartoum to Port Sudan. So we operate essentially out of Port Sudan. Between Port Sudan and the Darfur, just to give you an idea, it's 2,000 kilometers. But it's 2,000 kilometers, not of tarmac road. It's 2,000 kilometers of any type of road, of any type of roadblocks, with taxation, with request for all types of forms and stamps and any kinds of additional requests for us to be allowed to move cross-line. So in addition to operating cross-line, we are also operating cross-border, bringing food from outside, from Chad, trying to bring food through the borders of South Sudan. But there are 8 entry points to Sudan, functional entry point. One of them is Port Sudan. We have 2 in Chad, 2 potentially that humanitarian actors could be used from South Sudan, 1 in Egypt, 1 in Libya, and another 1 in Ethiopia. How many are working? Barely 1, which is Port Sudan, which makes it very difficult to go from far east to far west. So if we operate from Port Sudan to go to Darfur, it's very difficult. Even from Port Sudan to go to Khartoum, it's equally difficult, and so on and so forth, to go south to the Kordofan. That's why we need all the borders to be open. It was a breakthrough by the international community to have and to have ADRI open a couple of months ago, but that's not enough. The border was open during the rainy season, so where we should have been able to push 300 trucks per month, we have barely been able to push 150 in 2 months. So that's 1/5 of what is needed. The food is there. We do have food in Chad. We do have food in Port Sudan. So the point that you were just making with Ozan, the food is there. We do have contribution to buy more food. What we need is unfettered access. We need to be able to get to the people who need that food the most. So far, we've been able to reach 9 million people for the 18 months that this conflict has lasted. We should have been able to reach 9 million people per month, month after month after month after month. We've not done that. So 9 million people over 18 months, you can do the math. And it will tell you how far we are from what should be the target. So I will just add one point, if I may, and it's really the point that I open with every time that I make that I'm attending this type of panel or having this type of conversation. I want to say thank you to the civil society of Sudan. We keep on saying that the country has collapsed or is in the verge of collapse. And if it was not for the civil society, so the ERRs, the communal kitchens, the camp team leaders, it would have been a disaster. It would have been a disaster. More of a disaster. It would have been something else, something we couldn't even be talking about now. So what are we? What does that make us? That makes us the muscle that should be supporting that effort. And it's really something that we have tried hard now to do, and this will answer your last question. We have now signed contractual arrangement, because that's the only way that I can call it, trying to build the capacity of these ERRs. To my despair, we've only signed 15 of those. I would have wanted that we signed much more of those with the ERR to build their capacity. The way they are working is still so very rudimentary, the utensil that they have. Some of these people, most of these people, are volunteers. Most of these people use the money that they receive from the diaspora for themselves to buy food and cook for the community. So we are trying to give them some incentive, those that we have signed up with. And for that, we need contribution. We need more contribution. We need flexible contribution. We need food, yes, because food has to go into the market, but there is additional contribution that are required to support the local actors much more than what we are doing. Thank you very much, Kholood.
Thank you for that, Betty. I mean, what I would say is that the emergency response rooms and other mutual aid groups are already working very effectively, so I'm not sure capacity building is exactly what they need, but I think what you're trying to say is that there are ways to help scale up some of what they're doing. The question here is partnership. How much will they be able to dictate what this partnership looks like? Because that is something that in the past has always been the danger with civil society. They will be seen as co-opted and, of course, become NGOized and then become, of course, far, far less effective. So how are you guarding against, sort of fashioning these groups that are already effective as they are from becoming something that isn't?
So let me correct probably what I've said about capacity. What I mean is their assets, right? Trying to help them buy assets that will allow them to reach more people. It's very functional. I cannot take that back. How are we working? We've signed already a couple of contracts with them, so it means that already what we have put in place is working. There's the bureaucracy of the UN is there, obviously, so there's due diligence and so on, and all types of check before. But the targeting of the population who they are assisting and so on is something that we negotiate together. It's not something that we dictate. So what has taken time for us to reach where we are now, it's more the due diligence and the checks beforehand than targeting.
Okay, thank you. I just want to move on to Christina, but before that, just because of the Gaza comparison came up, and I want to just take a few minutes to address this, because yes, Gaza is getting a lot of attention, but as I've said repeatedly to UN officials who make the same point to me, just because Gaza is getting attention doesn't mean anything's happening in Gaza. The situation in Gaza is not moving forward just because there's media attention. So the assumption that if Sudan had more media attention, it would get more policy attention and therefore things would be moving is already not one that's rooted in reality. But just to say that when it comes to Sudan, officials should not be waiting for CNN to pick up a story in order to meet the needs, because quite obviously, when you're hearing what Ozan's saying, what Betty's saying about what the needs are, that should actually speak for itself. But Christina, I want to move on to you, because Germany has been a significant donor in Sudan's emergency response, with about 278 million euros provided in 2024. Not just to Sudan, but also the neighboring countries. But despite this, the response seems insufficient to reach people on the ground. So how is this being discussed within the Foreign Office, and what steps are being taken to improve the situation, in light especially of the inability of many agencies and INGOs to work in Sudan? How is the Foreign Office considering strengthening local actors?
Thank you very much, and I'm very delighted to be here amongst all of you who make such a difference in the humanitarian system and really work on getting assistance to people in need. And actually, I also wanted to start with an answer to the question, where is everyone? Because this morning I was in Parliament, and we had a very good discussion in one of the committees with the parliamentarians on humanitarian access, funding gaps, needs, accountability of those committing war crimes and crimes against humanity, alleged ethnic cleansing, and what this means to us and to the people who are suffering day by day under these very difficult circumstances. And in the end, one of the parliamentarians asked an innocent question because we were also devastated and looking at each other because it can't get much worse, right? We have famine, we have the worst protection crisis in the world, we have the largest number of people displaced multiple times, as we have heard. We have the health system has collapsed, the banking sector is barely working, so it's very hard to imagine how it can get even worse. And one of the parliamentarians asked, do you have a solution? I wish we had, but thinking about it, there is different strands to a solution. And number one is we must not let Sudan slip off the agenda. As has been mentioned by everyone, we must keep the attention. We must not look away. We will continue to speak out on the atrocities, on violations of international humanitarian law, on attacks, deliberate attacks on humanitarian operations. We will continue to advocate for access. We will continue to support the UN fact-finding mission, which looks into all of these serious allegations. And this is one thing we do. We are not looking away. We are working on Sudan on a daily basis and will keep it on the agenda, and I can assure you that. And beyond that, I mean, speaking about solutions, obviously on a very abstract level, there must be a political solution to the crisis. And Germany is also working on this in the margins of the high-level week of the General Assembly. Our minister has hosted a side event bringing together the various strands of negotiations, trying to figure out how we can proceed, how we can make this work. And we are also watching very closely what regional actors do. We are in constant contact with the UN, with the EU Special Envoy, etc. So we are really trying to work on the political track to come closer to a solution, even if it is inch by inch and not with big steps. The second thing we do on a daily basis is humanitarian diplomacy, and this has become a very prominent term, and it features in our new humanitarian strategy very prominently. For those of you who haven't seen it, we are very proud of it, and this is a very, very important element, and because we're talking about humanitarian access, but we are also advocating for it, starting from strategic access. So we have heard border crossings are existent but not operational. 8 border crossings. I was trying to track them down. How can this be that only Port Sudan is functioning? Adre, don't get me wrong, we are very, we had a glimpse of hope when we heard that Adre was going to be opened, but 3 months is not good enough. We need a permanent opening of Adre to get a constant flow of humanitarian assistance into Darfur, to be able to scale up humanitarian assistance significantly. And this is what we are saying on every possible occasion, what we are advocating for. Part of our humanitarian diplomacy and keeping Sudan on the agenda was also co-hosting the conference in Paris in April, where we have jointly achieved a record pledge of over 2 billion euros, which was good, but now we need to implement it, which brings me to the third priority, which is obviously our humanitarian programming. And I really support all localization efforts that we have, and we really try to put an emphasis on strengthening local actors and providing them with what they need. But we also need to keep an eye on securing the constant inflow of humanitarian assistance, because there will be no harvest in Sudan for the next couple of years as hostilities are ongoing. People will be on the move, and there will be no domestic production, or very, very little. So we need to ensure that there is a constant inflow of aid. Therefore, we need to keep crossings open, but also provide for a better operational environment for humanitarian assistance, for which we need the UN, for which we need NGOs, both local and international, to provide the network, to provide the infrastructure, to bring aid in, to be able to scale it up and get it to the people in need who are suffering on a daily basis.
Thanks, Christina. I'm just going to press you on this point, though, about local actors. How is the German Foreign Office working with, looking at funding, looking at supporting politically, etc., or providing protections for local actors who we know are at the forefront of the humanitarian response?
So we haven't really talked about the money, but as I'm sure most of you know, we have committed 244 million euros to Sudan and the region in Paris. And we are well on track on overfulfilling this pledge, significantly, I have to say. And obviously, if you will look into this in more detail, there is a big chunk of funding for WFP, there is funding for NRC, there is funding for UNHCR, and the usual suspects, so to say. But what we really insist on and keep an eye on is that everybody who receives funding from the German government explains how local actors will be supported and how they benefit, how risk sharing and burden sharing with local actors will be ensured, how they are part of the programming and of identifying the most imminent needs. So while you will see a lot of money going to WFP in our pledge, there is still a lot of effort underpinning this money to make sure that local actors benefit.
Is there any likelihood we'll see a German office localization strategy by any chance?
Please ask my colleague Mehdi tomorrow.
I will,
no,
for sure.
I'm sure, so localization is also one of the priorities identified in our strategy, and we are constantly working on empowering local actors and making sure not only, it's not about capacity building. I really don't think that, I worked in Ukraine before, so every time somebody talks about capacity building in Ukraine, I get very upset because I always say, who needs capacity building? We or the Ukrainians? And I think this is exactly the same in many, many contexts. Local actors understand much better what the communities need. They understand much better what works and what won't work. They have much better networks and can figure things out and make agreements that wouldn't be possible on a more technical level. So out of pragmatism and to increase the efficiency of the humanitarian response, there is no alternative to localization, and we are constantly working on it. I'm not sure we have looked into the option of a localization strategy, but I will definitely take this home and see whether we can get some traction on this.
Thank you, that's great to hear. You asked earlier whether, don't worry, I'm not going to ask you another question. You asked earlier how bad could this get, how much worse can it get? And just so everybody knows, there was some recent number crunching that was done about some of the famine figures that we're seeing. There were initial figures for this year that said about 2.5 million people in Sudan may die because of a famine. Those have now been revised for a cumulative figure of 12 million by next June. So that's the kind of prognosis that we're looking at. So when we're talking about how insufficient the humanitarian response has been, that is really what I hope that we all keep in mind. And because of that, and when we look at what's working, particularly on the ground, that will require massive scale up to be able to respond to that. So Maryam, I want to turn back to you and just ask, how do these structures, these mutual aid groups that are working on the ground, what kind of support do they need from the international community, just to be able to sustain the efforts, but also to scale them up?
Thank you for that question, Kholood, and thank you also for the elaborate explanation about the situation of delivering mutual aid or delivering aid to Sudan. So what the mutual aid, or let's say what the grassroots structures need right now is, first of all, protection and recognition. They need to be recognized as humanitarian actors, as local humanitarian actors. They need to receive the adequate protection that is needed because they have lost, many volunteers have lost their lives, or many volunteers are still risking their lives to connect to the people and to make sure that aid is delivered to the right people and the right communities. And they're still risking their lives every day as they face the security risk. It's not only from the the shelling, the bombing, but security risk as in scrutiny from both of the warring parties. So they need protection, they need recognition from international and local actors. They need more fundings, and there's a dire need for also partnership. I understand that there might be challenges, that this is a new context for international actors, that this is a grassroots structure that is not, maybe the systems cannot match together, the international aid group systems, or let's say the UN system and the local group system, but there can always be a room for tailored response. As they say, dire situations or extreme situations call for extreme measures. And I think from the international actor side, there is a need for them to adjust or tailor their response or tailor their administration process to match the situation in Sudan, to serve the overall objective of alleviating the suffering of the people of Sudan. I can take the example of the lifeline that was established during the war of South Sudan, and deriving from the challenges, or let's say from the lesson learned from that lifeline, I would say that in terms of local structure, we have the adequate local structure to make sure that the aid is going to the right people. We have the connections. I think what is missing are two things: is the humanitarian actors' willingness to change or alter their way or modality of working to match the situation, and the other part is the tough part actually is the negotiating the humanitarian access. But to add on to comment, or actually to elaborate a little bit on the humanitarian access part, I think the benefit or the merit of these local structures is that they are formed at grassroots levels, and they are actually they represent the veins that run or connect all the areas of Sudan, on all the areas, be it areas of conflict or be it areas of safe areas. So we have already an established network of people, of brave volunteers who are willing to do what is needed to deliver aid. We are in need for So this means that we have the network that can help us distribute the aid that can be received from international actors. I can understand that there are challenges, as my colleague earlier mentioned, is that Sudan's entry point can only be Port Sudan and Chad for the moment, or maybe at least, North Sudan. But with the support of the local community structures, they can make things happen because we have, or they have, the adequate or the appropriate network to be able to connect. And they have also the ability and the acceptance of both parties with the power of negotiation to be able to make things happen and pass things through the different conflict areas, be it areas controlled by RSF or be it areas controlled by SAF. So to summarize, what I'm trying to say is that I think we need to benefit from the lessons learned we need to duplicate the experience of the Sudan Lifeline. We need to benefit also from the lessons learned. We push for international actors to alter or modify their modality of work. We need to recognize that. We need to recognize the power of the mutual aid groups, of the local grassroots structure, and we need to push forward for their protection and have more partnerships and funding for these local community structures. Thank you.
Thanks, Maryam. That's all very, very clear. And I think it's important for everybody in this room to recognize that those who work within the space, the mutual aid space, know exactly what they want. They want protection, they want extra funding, and they want to be able to create partnerships where they are able to lead on what the response looks like, because of course they are on the ground and they have these connections. And I think that's a point that often gets missed. But Betty, I want to turn back to you. you know, Maryam just mentioned Operation Lifeline Sudan, which of course was a very large operation to feed the people of what is now South Sudan during the Second Sudanese Civil War. Is there, you know, room for that right now? It seems like the will isn't there, and frankly, the purses aren't really there to afford that at the moment. Or rather, I should say, there's lots of money around, but it's not going to the right things. So what is WFP effectively doing in order to really scale up some of these pilot projects that you mentioned? You mentioned the cash transfer project, which is a pilot as far as I understand. You mentioned a few other working with mutual aid groups, also a pilot. You know, how do you plan to scale these up, frankly, very, very quickly? And particularly in areas such as Darfur, I mean, WFP has been not able to, or just to say missing from Darfur for a long time. And that in many eyes, I think, is quite unjustifiable considering the means, the challenges and the needs that are there. So what other alternative, you know, avenues are being explored while these difficulties that we all understand exist? And how, mostly importantly, would you manage the scale up?
Thank you, Kholood. Thank you, Maryam. Definitely, as you said, so the will is there. The will is definitely there, and the fact that I was detached from my day-to-day job and sent to supervise the preparation for the scale-up, all the scale-up, is a significant step towards the direction of showing the will of WFP and the international community overall. So as you said, most of these new localized efforts are pilot because we don't have the type of funding that we require to be able to do that type of work. Funding is there in very specialized manner, if I can put it that way. So we have funding to purchase food, or we have funding that is attached to food that is already coming in the country. So we have to use it a certain way. So the contributions are what we call earmarked or tied to certain use in the country. So what we require is different type of funding, flexible funding that will allow us to work with a multitude of partners and that will allow us to work in a different way with those multitude of partners. So already what we have done in Zamzam is very creative in the sense that it's going out of our comfort zone. So what we have done in Zamzam is we are working with an association of wholesalers, so local actors, who are bringing commodities from outside, bringing it into Sudan. They are the one doing the kitting locally, and they are the one who are with actually a German NGO partner doing the distribution in the camp. So that's already going outside of what we would normally do, and more. So these are the type of now activities or food assistance that we want to develop in Sudan. Sudan is particular, and it's challenging, yes, but it's doable. I still have the hope that it's doable. If we have the right type of funding, if we are all hands on deck, and that when contributions are received, they are not tied to either geographical area or to a certain type of modality, buy food or use food, that the contributions are as flexible as possible. We can scale up, and we can scale up fast, because the diaspora is using all kinds of modalities to do money transfer, and that's working. And Red Rose that the diaspora is using, not to name it, is also something that we want to use.
Maryam, would you mind putting yourself on mute, please?
Yeah. We are also providing cash at hand. So in areas where markets are functional, where we know that markets will come, if the population has money, we provide cash at hand. The main issue that we are facing now is lack of liquidity in the country. So the main hard currency in Sudan now is food assistance. That's why it's being taxed. That's why it's being looted, and all kinds of things are happening. So that's also another impediment. The looting, because the soldiers or the armed groups are not being paid, and the only hard currency that you find in Sudan is food assistance, is also not helping. But I'm not trying to find excuses here. We should be doing more. We should be getting much more attention. We should be getting much more flexible funding for us to be able to work more with local actors. And we are geared to scale up already.
Ozan, I want to come back to you because I want you to just talk about what you had begun to explain to us earlier, some of these challenges and some of these blockages. But I also want to pick up on, how is MSF adapting its own strategies effectively to ensure it can reach, people in need, and then also how it can protect some of these groups that it is, seeing, these mutual aid groups in the same regions that you work. How are you sort of developing different ways of working with them that provide them that protection?
Thank you, Kholood. Maybe I should start by saying that access is really difficult but not impossible, and maybe correct one thing here is that Adre border is open. We have been crossing through Adre since last year, December, so almost 1 year now. Doctors Without Borders and many other groups are crossing that border to deliver humanitarian assistance. This border, or that, let's say, the border area is used by everybody, the people, the animals, the guns, the money, whatever you think, but the only embargo right now is on the humanitarian aid, and there are political choices that needs to be acknowledged here. Following the sovereignty claims of the government of Sudan puts UN in a certain position where they have to abide by certain rules, and that results in not being able to cross the borders, or at least not in a substantial amounts that should be. There are many other challenges as well. There's the natural disasters blocking the road, there's the insecurity blocking the road, looting, armed robbery, definitely those are major issues. But, as Betty said, we have to do more because this cannot be an excuse. At the end of the day, success needs to be measured by the outcomes, and the outcome is miserable. What we're seeing in Niala is arrival of trucks less than the fingers in a hand. We're counting trucks, 1, 2, or 3. These are the numbers that we're counting that arrived in Niala, the second largest city of Sudan. That needs to change, and that needs to change with radical solutions, with creative solutions, with solidarity with the local responders, but also, as Betty said, all hands needs to be on the deck. That's not a crisis that scale cannot afford some of us shying away, or some particular groups shying away. It has to be a situation where everybody is involved and contributing. It's a really good point, an important one, that the local responders needs to be protected, even to an extent maybe sometimes needs to be emphasized more than the international actors because of the lack of voice when it comes to local responders. They need to be represented in those platforms as well. A lot of times we hardly see, and it's not on those groups, but we hardly see the opportunity given to the local responders initiatives to be actually part of those negotiations. An important nuance again, the ceasefire talks are important, the peace resolution is extremely critical, however, it needs to be separated from the humanitarian access negotiations. These two cannot be conditional to each other. We cannot wait for ceasefire to access populations. When and how long? Then what will happen when the ceasefire is over? International humanitarian law obliges all warring parties to facilitate humanitarian aid without any barriers in every circumstances, particularly when the conflict is at its peak, when the people are dying, not later on, not afterwards. What MSF is doing is actually not too different what other colleagues mentioned. We're trying everything we can. MSF, most of you are familiar, is an organization traditionally provides humanitarian medical assistance hands-on with a proximity. We prefer to be in places as much as possible. And since the beginning of the war, again, just to clarify, Doctors Without Borders have been working in 9, 10, 11 states, depending on the timing, because sometimes we're not always able to access, with international staff on the ground for a very long time. We're trying to increase that, so we're doing a lot of partnerships with local organizations or civil society groups and initiatives in a very, let's say, unorthodox way for MSF. So we're also learning this experience. When I was there in Niala, a group, a committee, they call themselves a health committee, they are really well organized, came from an IDP camp, Al Salama camp. That camp had a clinic that was supported by an international organization for a very long time, but they had to leave. They left after the war started, and that clinic was left empty. The staff who used to work in the clinic organized themselves, set up a committee, came to us and asked for support, and they were very clear. They said, we don't want money, we don't want anything else, we don't want trainings. We need supplies because we already have the clinical officers, we already have the nurses, we already have the place, the building, really nicely cleaned and kept. We just need the medical supplies. And after providing that, it provided the boost, and they were able to provide the medical care. Now, us giving the supplies with very limited capacity is not sustainable. And that's where we need the international actors to take a more active role with the funding possibilities, flexible funding possibilities. You just mentioned about Ukraine. I was also in Ukraine, and it's incredible how big difference is there, because in Ukraine, all the donors were so comfortable to flex all the funding. The requirements were shortened, the process was shortened, the language barriers were reached very quickly, very easily, because there was the willingness. There's no willingness in Sudan. This could happen in Sudan too. It's not so difficult. But the only funding available for the local organizations to apply in Sudan is a Sudan Humanitarian Fund, SHF, which has an incredible long and bureaucratic process. So no civil society organization or grassroots organization has this professional skills and understanding to even be able to fill the reporting requirements, let it spending that money and being able to manage that funds. So the donors needs to accept that there is going to be challenges, loss of funding, there will be other barriers coming. We have to accept those risks, and we have to also shorten the way, make it easier for the local organizations to access those funds when it comes to donor side. On our side, as MSF, as I said, we are trying to get out of our comfort zone and working with local partners and organizations in many different ways, which is not enough. It's one step only.
Thank you for that, and thank you also for the Ukraine comparison, because actually I think that's more useful to understanding the shortcomings in Sudan, not the Gaza comparison, because we do see an incredible amount of alacrity when it comes to Ukraine. The aid budgets are usually overfunded. There's no problem in loosening some of the issues. But I guess that is how international structures of racism operate in the humanitarian world. None of us are strangers to that. Christina, I want to come to you just for the final question before we turn to the audience. This may be tomorrow's problem because, frankly, localization isn't being done at all. But how do you start from now trying to figure out how not to overburden local actors with the humanitarian response? Because we have seen just in the past few months now that localization is becoming more and more, du jour. We're seeing that there's some laziness, frankly, from large NGOs and the UN. We'll just let the emergency response rooms, we'll let the mutual aid groups cover the humanitarian need, and then they can just, sit in Port Sudan or sit in Nairobi. So how do we ensure that that doesn't become very, the way of things to come once localization becomes more and more an acceptable new normal in Sudan?
Maybe just one word on Ukraine. I think there is a huge difference we must not overlook, which is that in Ukraine we have a functioning government that respects international humanitarian law, and therefore we have a different working environment. We also have public services and a federal budget and a functioning state under an aggression, but still this is a huge difference, and I think it adds to the equation that makes Sudan so difficult, because we have two warring parties and no solution in sight. And therefore, maybe just to make this point on Ukraine, but coming to your question on local actors and how not to overburden them, this is a huge and very imminent concern, because unlike in Gaza with some of the humanitarian organizations, there is no rotation they are stuck there. They are under constant pressure and under constant demand, given the sheer gravity of the situation. And also for us especially, it's very difficult because I really appreciate all the insights on the ERRs today, because it's very hard as they are not a unitary actor. They are present across the board and the challenges are much different, and it might be medical supplies in one space, it might be a lack of facilities in the other because everything has been destroyed. So for us as governments and as donors who try to be good and provide the money as flexible as possible, it's very challenging. I'm really trying to listen to the feedback from those actors, but for us it's also not so easy to access them directly. So we really need to make sure that we use fora like conferences, like high-level events, to really try to hear from the ground what are the challenges and how can we ensure that there is no overburdening of these actors, and listen to them very carefully, take into account what they have identified as the main challenges, and try to work on this, try to support them. If it is protection concerns, we will try our best to address them. If it's about risk sharing, we try to incorporate it into our funding. If it's about administrative costs, etc., that are often overlooked for those actors, we are also trying to find creative ways, as much as it is possible within the remits of budgetary law, which always allows for limited creativity, but still we try to use all of the margins of discretion we have to really make a difference on localization, and not take it as a given, but reinforce it, strengthen it, highlight it, and do our best that our efforts are considered as supportive.
Thank you. I think we have time for maybe 3 questions from the floor. So please raise your hand, and then one of our stewards will be able to.
Yes, thank you very much indeed. My name is Ilham Ibrahim. I am the ambassador of Sudan here in Germany. It is good to see you, Ustaza Kholood, and also to thank the panelists and the organizers for this very important panel, and thank you for inviting us, actually. I'm very much encouraged by the title of this panel, Understanding the Gaps in Sudan's Emergency Response. And I think it doesn't concern you only, it also concerns us. As Sudan, as normal Sudanese people, let alone being representatives of our own government. Actually, you raised so many important issues, and I must thank you for your concern for what is happening in Sudan. Your organizations are very important organizations to us. They have been partners to Sudan for such a long time, and we do believe you are doing a great job in this difficult time that the Sudanese people are witnessing due to the attacks by the RSF militia, as you all know. To us, actually, I agree with you on so many points you have raised. It is very difficult to reflect on all the issues you have raised, but I will try my best to at least to mention a few points. And by the way, I have to leave very shortly because I have another appointment in the Bundestag. But I believe, or we believe, that what is happening in Sudan is such a complex crisis. It needs to be understood in its holistic approach. I know that today you are addressing the problem in Sudan from purely humanitarian side, which is extremely important. But we do believe it needs much more, to be addressed in a more holistic approach, including addressing the external factor and the regional sponsorship of what is happening in Sudan, at least from the side of the RSF. I agree with you on a few issues, like the inability to scale up the robust operations. And I think this goes particularly to the lack of sufficient humanitarian response in terms of the commitment to the pledges by our partners. And let me take this opportunity to thank Germany in particular for being forthcoming in this regard. The humanitarian response is definitely lacking, and I agree with you, Ustaz Kholood, regarding the comparison of Gaza. Actually, we always take this comparison not only of Gaza, but also of Ukraine. And I think you mentioned it, the issue of racism in humanitarian response. We are taking it from the perspective of the number, the sheer number we're talking about more than 10 million IDPs, while in other countries like in Ukraine or in Gaza. And you all know the position of Sudan when it comes to Gaza and to Palestinian issue. So it doesn't by any way mean that not having media coverage, action should not be taken. Definitely, it goes without saying. For WFP is one of the largest supporters of Sudan, especially in this difficult time. And I think the government has opened the 9 outlets cross-border. But the main challenge that is facing us now, it is cross lines, where RSF is putting, checkpoints and, looting and, not even taking the assistance to the needy people. And I think what happened to MSF in many occasions is a case in point, like when your trucks were kept by RSF in Kapkabia for a few weeks, and we don't know what is the future of this assistance. Another point is the importance of the civil society. And I totally agree with you, and I thank you for raising this issue, because now the emergency rooms roles is very important, as well as the local kitchens and the Sudanese civil society. I think they should be given more confidence. And personally, I have been raising this issue with the German Foreign Office, and they are very convinced about the role of the local civil society and the emergency rooms. And now we are exploring ways and means on how to coordinate together with the German side in order to support these rooms. I wanted also to raise a very important issue. It is an overall issue, which is the importance of taking the correct approach to understanding the crisis, and to explain it in the right way. I mean to have the correct narrative of what is happening now in Sudan.
Ambassador Ilham, I'm sorry, we're just almost running out of time.
Okay. Last point is, it is important for you, maybe, if we can raise the point, to have what we call the humanitarian development and peace nexus. It is very important in a country like Sudan, especially when you spoke about the difficulty, the logistical difficulties, and so on. And don't forget that all the government offices after the war, they have relocated to Port Sudan. They are facing a lot of logistical problems and bureaucratic problems. So we should take that into consideration as well. And the refugees, IDPs, now we are facing multiple problems because we already have refugees from neighboring countries. So we are faced with 3 types of refugees and IDPs, and that should be taken into consideration. Thank you so much.
Thank you, Ambassador. I'm not sure we'll have much room for any other questions. We can? Okay. Any other burning questions? Yes.
My name is Max. I'm from Diakonia Emergency Aid, and my question goes to Christina. You mentioned the role of humanitarian diplomacy that Germany pursues in this crisis, and I think one elephant in the room is the role of the UAE in enabling violations of international humanitarian law in this context. Germany, on their side, has very strong diplomatic relations, I think even a strategic partnership with the UAE, and growing economic relations. So how are you using those leverage points, economic and diplomatically, to kind of ease the humanitarian situation in Sudan?
Great. Any other question? And then we can go back to our panel. Yes.
Thank you so much for the presentations. My name is Khadija Saidi from Maternity Foundation in Denmark. My questions go to Betty and Ozan. It seems like localization is offering a point of success in terms of showcasing what localization can do in the humanitarian system. What are lessons or successful models that you can propose using the Sudan context as an example? Successful ways of implementing localization, basically, based on your experience, Betty and Ozan. Thank you.
Great, thank you. Who would like to go first? Christina, you had a question that came specifically to you. Go ahead.
I would like to say it's an easy one, but obviously not. We are talking very much about broadening the donor base. And it's very interesting to see where the United Arab Emirates are coming from near to zero to one of the top 10 donors in Gaza, providing humanitarian assistance through the UN in Sudan. But obviously, that's only part of the picture. And we are also aware of the New York Times reporting of the misuse of humanitarian actors to supply arms. And I can assure you that this is being raised with authorities. And while we are talking about how we can do more together, this also provides us with the access to the actors. We need to discuss these difficult questions as well. So we're trying to utilize it to say what we appreciate from the United Arab Emirates, which is funding through the UN organizations, which is what we need with increasing pressure on our budget. But at the same time, we need to have benevolent humanitarian actors who act in the spirit of humanitarian principles and supporting one side of the conflict, one of the warring parties. For us, obviously doesn't fall into that category.
Does that answer your question?
Yeah, I mean, more questions, but...
No problem. I know it's a sticky subject, but I'm glad you're able to answer it. Betty, can we turn to you?
Yes, thank you very much on your question about localization. Localization is very much part of one of our principles, if I can put it that way. We are pushing much more the envelope in WFP to purchase commodity as close as possible to the population that we assist, right? As a mean to re-inject the contributions that we receive in the local economy. So we have a lot of activities that are promoting local production of some of the food, using indigenous crops and so on and so forth. So we already have an activity like that in Sudan, in the Gedaref area, with the African Development Bank, where we provide agri-input to some of the farmers to help them produce more sorghum, more wheat, and so on locally, so that we can either help them sell it outside of Sudan or inside Sudan. So that's one of the activities that was very prominent before the war. It continues to happen now to a lesser extent, but we are still pushing it so it doesn't die completely. That's one way. But in terms of using local actors for humanitarian response, we've learned a lot from Sudan, because our own bureaucracy to recruit partners, if I can put it in those terms, and I have a poor choice of words today, but to select partners is very long, right? It's a lengthy bureaucratic system that Ozan was just describing. So we did adopt some emergency protocol to make that selection process shorter, yet adhering to certain risk factors and certain due diligence that our donors are asking us to follow. So we are caught between two things here. We have to abide by certain limiting rules in terms of how we partner, in terms of where is funding going and so on, and we have to make our processes agile enough so that the partners locally who are not necessarily fully informed about what the UN is about and want to sign 2024 have to find. So all this to say that we had to be very creative to adopt more agile and flexible solutions to be able to respond faster. So I think in many instances we have said that we will go for speed over perfection, right? And that's a Sudan thing. It was really created because of Sudan. And we have agreed with some of our donors that the risk of making mistakes will be a shared risk that they will accept and that we will share. So if I can put it that way, that's what we've learned from Sudan, and we are going to we have piloted and we are going to expand. The answer is not a one-size-fits-all. What I'm trying to say is that the local actors alone cannot address the crisis. The UN alone cannot address the crisis. So it takes all of us, and I really want to insist on that it takes all of us to be able to scale up and to partner and to be more flexible in the level of risk that we want to take so that we can expect to address the crisis to a certain level. And I use again crisis.
Ozan?
I was going to add what you actually said in the end. Localization or local agenda and local responders are great, but it's not a solution to everything. And we should approach this as a joint action. We have to be all involved in that. The local civil society elements are under attack as well. Let's not forget that they're not always everywhere in Sudan are in the same shape or in a good shape. There are many places where the volunteers are taken, detained, arbitrarily arrested, killed, and that lack of protection is a major concern. Of course, we need to work through improving those conditions and circumstances. That's the goal. But in the meantime, with the scale, with the complexity, with the insecurity, we need all actors to be involved. And so we should be careful about deferring responsibility as well, because we should still ask the question, what's the responsibility of the international community here in this picture, while localization is one of the answers to this very difficult and complex question.
And Maryam, do you have anything to, no question was posed directly to you, but do you have anything to add? You're on mute if you're speaking.
The screen over there says it's mute or it's cut off. Yeah.
Okay, we can take one more question. Any takers? Yes.
Hi, thanks very much. My name is Pat McMahon from Mothers First. I suppose, look, the elephant in the room is the underfunding. Like I've just looked up now for Sudan, it's 52. The humanitarian response plan is underfunded by 52%. And is it time to rethink kind of the voluntary funding model that we currently have to a mandatory funding model? The reason I ask that is that the high-level panel on the World Food Security meetings have recommended exactly that, to go from a voluntary funding to a mandatory funding model. So that's just one question. And the other question I would like to ask is, what impact do you think that the chronic underfunding of humanitarian response plans is having on protracted crises and newly emerging crises? Thank you.
Thank you. That's a very good question. Anyone else before I turn back to the panel? Okay, should funding be mandatory? Christina, I think this one was made for you.
Thank you very much. I think this will only partly solve the question, because it's much more complex than just sheer underfunding and do we really want to have mandatory contributions. I think we need to work on various tracks, maximizing the impact per euro, reaching people in need. And to this, there's a great variety of tracks we need to pursue, and one is improving the efficiency of the humanitarian system. We need better coordination, we need tailored approaches, we need to strengthen local actors, we need to cut overhead costs, etc. So improving the efficiency, having a good share of responsibilities among actors, etc., to just really increase efficiency is one track. Track two is humanitarian diplomacy, and making sure that the money and the goods actually reach people in need. There's other tracks like anticipatory action. We need to act in a more anticipatory way to prevent these crises, to reduce vulnerabilities, and then obviously working diplomatically to prevent crises from erupting. And this is only what I can offer in the final 3 minutes, but I think we need to take a holistic approach, and this is obviously only part of the answer, but I don't think mandatory funding will be the silver bullet here.
Thank you. I do want to come to Betty, but maybe the point should also be that when countries pledge money, they should actually meet that pledge. Let's start there, maybe, and then we can move on to mandatory. So, Betty, you wanted some minutes.
Thank you very much, Kholood. Should funding be mandatory? Yes. Yes. And yes, it should be. Yes, because there is something called responsibility, right? We are all accountable for what's happening in Sudan and elsewhere. So should funding be mandatory? The answer is yes. I fully agree with everything that Christina said. It's a must, right? And even more so, when the funding becomes mandatory, we should be held even more accountable. But in the case of Sudan, that's not the only issue. Underfunding is an issue, but lack of access is another one that should be fixed through humanitarian diplomacy. The fact that cross-line we cannot access from one side of the country to the other side of the country is an issue. And as I said at the beginning, the food is there. Our warehouses are full with food in Chad and in Port Sudan. So let's start with getting access to the population who needs that food the most. Thank you.
Perhaps to Max's question, the countries that we know are responsible for funding the war should definitely be given some mandatory expectation that they will be also funding the humanitarian crisis, as ridiculous as that would be. I would just like to thank the speakers, Maryam, Ozan, Betty, and Christina, for their time. I've also been asked to let you know that there's now a half-an-hour break, which we've eaten into, so apologies for that. And then the following sessions are Decisions on the Edge, Handling Dilemmas Concerning Fundamental Humanitarian Principles, which will be in this room at 3:30, Funding Gaps and Changing Narratives, a Balancing Act, which is one floor above, and Medical Care Under Fire, Reclaiming Humanitarian Spaces. Those are all, that's down the hall here at the end, and they're all happening concurrently at 3:30. Thank you all for your attention and engagement, and have a good rest of conference. Vielen Dank.